subluxation.
Alright, so we're going to do, well, first we're going to do a muscle test. We're going to use the TFL. Okay, and I get you. Okay. We're going to assess the hip. And this is going to be assessing internal rotation, checking for an external rotation subluxation. If it sticks, it's external rotation subluxation. Okay. Now it seems to be okay. And now we're going to assess the other direction. So we're going to be assessing for an we're going to be assessing external rotation. If it sticks, it's an internal rotation subluxation. Excuse me.
Sorry.
And if it sticks, then you're going to impulse through it. You're slippery.
Right. Retest the muscle. Make an appropriate statement.
Okay. And it's strong.
Right. Demonstrate the elements of a wrist extension technique on an empty table, stating the appropriate amount of pressure for each hand, knee, hip, and shoulder.
Okay, if we're doing wrist extension technique, then I'm going to use my non-dominant hand as my pressure hand. I'm going to use 50 to 70 pounds of pressure. And I'm going to lay it down. I'm going to use my speed hand as my dominant hand. And we're going to clasp like this. And I'm going to have my right knee up since I have a right speed hand. And there's about 10 to 20 pounds of pressure on my speed hand with 50 to 70 on my pressure hand. And we're just going to hit this, and we're going to leave it together to allow the percussion to get down through the thumb. For the hip, we use 50 to 70 pounds of pressure, but for the shoulder and for the knee, we use 50 to 70. For the hip, we use 10 to 20, and for the shoulder, we use 10 to 20 on our pressure hand.
Okay. Now perform an assessment of the knee and determine a listing stating what you found.
Okay. So we're going to do a muscle test. Hold it like up there. Okay, and we have an anterior femur. If we have a 4 or less, we're going to go from the greater trochanter over to the mid-thigh, and we're going to take that same distance down. We're going to lay our pressure hand right in that area, and we're going to be using 50 to 70 pounds of pressure.
Perform the wrist extension technique on the listing you just found. Oh, we just did that. Reassess the knee, make it an appropriate statement.
Oh, I should probably do the knee this time then. Alright, I'm going to assess the knee. And we have a lateral condyle. So if you'll flip over. We're going to contact the lateral condyle, which is directly above the bend of the knee, about 1 thumb's distance apart from the spine. We use 50 to 70 pounds of pressure.
Test.
Okay. No motion.
Now shoulder.
Okay. And for the shoulder, lift it up. Resist. Okay, if that's a 4 or less, we're going to come into the delta pectoral groove with our pressure hand, and we just slide it over. Alright. So delta pectoral groove using 10 to 20 pounds of pressure with our pressure hand. In a weird spot. I need you to move down on the table. It's okay. No, it's okay. This table's not for this, obviously. I'm going to kick our hip in. And okay. and it's strong.
Alright. Now, perform a wrist extension technique for the correct anterior. Close adjustment, muscle test, you did everything.